breath permanently. Talking and interacting with someone with bad breath is one of the most undesirable social situations possible. If you have bad breath, it can be very distracting to the people you are talking with and will likely develop a negative reputation because of this. Although masking your bad breath with mints, sprays, and gums can work temporarily after a meal, it is not a good long-term solution for people with chronic bad breath. Bad breath, also known as halitosis, can have several causes. The treatment for this condition will depend on the cause for each particular individual. Here are the following causes of chronic bad breath and how you can treat or cure this very unpleasant condition. The most common cause of bad breath is poor oral hygiene. Oral bacteria is responsible for bad breath in most people, and proper oral hygiene is key to fixing this problem. There are two parts to this. Proper and consistent daily home care. This includes brushing teeth twice a day, morning and night, for 2 minutes per session. Using a high-quality electric toothbrush has been shown to be more effective at cleaning plaque off of your teeth than a manual toothbrush. Flossing at least once per day using a water pick can be just as effective, if not more. Tongue scraping and brushing. A lot of bacteria resides on your tongue, so don't forget about it. Using a tongue scraper is usually more effective than a toothbrush in removing this bacteria. Antimicrobial oral rinses. Although not a necessity, many people have had a lot of success using certain kinds of mouthwashes. I personally recommend Listerine, and it is also a product that carries the American Dental Association seal of acceptance. There are also prescription-strength oral mouthwashes you can talk to your dentist about, like chlorhexidine. Regular annual dental checkups and dental hygiene visits at least every 6 months. Tartar, also known as calculus, must be scaled off by a professional dental hygienist. It cannot be removed by simply brushing. Dental decay, gum disease, like gingivitis and periodontal disease, are known to cause halitosis, so visit your dentist regularly. Another common cause of bad breath is dry mouth. Dry mouth means there's low salivary flow in your mouth, which allows oral bacteria numbers to build up faster than normal, which can lead to halitosis. People can get dry mouth from certain types of medications they are taking, so consult your physician if this is the case. Dry mouth can also be from mouth breathing. Mouth breathing almost always happens when nasal breathing is limited for one reason or another. Some people cannot breathe through their nose due to an anatomical obstruction, like a deviated septum, while others have allergies which prevent proper nasal breathing. Discuss these issues with your family doctor and possibly an ear, nose, and throat specialist. A third and common cause of bad breath is diet. Certain foods like onions and garlic will cause temporary bad breath. However, some people may not be able to digest certain foods properly, which can also be an underlying reason for halitosis. Smoking is a known cause of halitosis as well. The solution to this is just to stop smoking. Allergies and postnasal drip, nasal rinses like Neti Pot, Neti Rinse, or NeilMed can help. However, consulting your family doctor may be necessary if the problem persists. Finally, more serious medical conditions have been known to result in halitosis. Examples of these are sinus or nasal infections, throat infections, lung disease or lung infections, intestinal infections, diabetes, liver disease, kidney disease, and acid reflux or GERD, or gastroesophageal reflux disease. If you have any questions about halitosis, please contact us at smilesdentalgroup.com. All of our consultations regarding halitosis are free of charge. Thank you for watching, and remember to like and share our video.